to the Class Video Spotlight Series. I'm your host, Joshua Jensen. Today, our guest is Joe Vandegraff. Welcome, Joe.
Hi, Josh. Thanks for having me.
Glad to have you here. Hey, today we are talking a little bit about Enterprise Health and the spotlight we did on their solution around vaccine distribution. Now, vaccine distribution, to me, seems like an important topic right now with COVID and everything else that's going on. But Enterprise Health is not necessarily a new vendor within healthcare. What can you tell us about Enterprise Health?
So on Enterprise Health, and actually even before that, a few thoughts on the technology and the process that we need to look at as we think about vaccines. So you and I go in and we had a vaccine and we go home and my arm hurts.
Yes.
And I actually had mine and I was sick for several days and I even had COVID.
Okay.
So that's what you and I think about, right? But when we consider the healthcare organization or even the pharmacy, I got mine at a local grocery store, right?
Okay.
Who is giving these vaccines, there is preparation, there's tracking, there is reporting. There's a lot behind the scenes that goes into this.
Right.
So in the state of Utah right now, for example, I think it's 40 to 50% of Utahns, where we live, are at least partially vaccinated. That's good. Well, how do you know that?
Right.
There's a ton of information and tracking all this that happens behind the scenes. So it's not just, hey, I got my vaccine and I'm good. We have to track this. We have to understand it. And it's not just consumers. It's also employees who are at healthcare organizations, our frontline workers, as we often refer to them, who have been responding. So Enterprise Health, we wouldn't necessarily refer to them as a vaccination solution vendor. They more play in occupational and employee health, which we actually don't even formally measure at Class. But it kind of fits into this category where occupational health, and they happen to have a vaccination management type solution that they created over the last 3 months. And so we chose purposely to do a spotlight on this. Is this working? How is it helping? And how is it used?
So my understanding from talking to some of their customers is that they took their flu vaccination solution and then tweaked that or modified it to use it for COVID. And from some of the conversations I've had already, the results have been positive. What have you been hearing?
Yeah, so I had a few calls, and some of these customer organizations are employers, and some are healthcare organizations.
Right.
So the typical way that you would probably see something like this used, or occupational health, employee safety, is in manufacturing or other environments where people are performing manual labor and there's risk and you need to manage it. So that's one environment where you may have, these solutions that are used, but also in a hospital.
Right.
And you're looking at the often employee, which could be a frontline worker, which could be someone. Either way, the conversations I've had on Enterprise Health have largely been positive. This is making a difference, but it's not an altogether new, completely, from the ground up. It's largely based on what the solution provider had already created for other related initiatives and had engaged with their clients and tweaked it in a way that was useful and timely. And the pickup that we saw happened pretty quickly, as you'd imagine, with vaccine rollout being probably arguably the number one initiative in our country this year. So the feedback has been positive, but it also is just part of the overall story. And at Class, we haven't measured that overall story. It kind of fits into the world of occupational health, but EHR used for purposes there, and that's where the vaccine solution. So we have validated a lot of vendors in the EHR marketplace, but this is a solution very specific for vaccination purposes and tracking and reporting. And there's so much. I had a discussion with a CIO. I remember this going back about 3 months before we did the Spotlight report on Enterprise Health. The question was, how are you managing the process of tracking and reporting and all this?
Yeah.
And this is actually what prompted our looking into a Spotlight on, and at the time we didn't even know this, who the vendor was, but Enterprise Health. But this CIO said, we're using like our ERP system, we're using spreadsheets, we're making phone calls. It's just an absolute mess. We probably have 15, 16, 17 different ways we're trying to track this. And they said there is nothing that we're familiar with that really solves this problem. And so we started looking for what is out there and is there a solution that would help health systems and employers as they go down this road and as we try to get back to normal, whatever normal might look like.
So Joe, any challenges the customers ran into while we were doing the research?
One challenge that did come up, and I'd say it was not a heavy challenge, but a reality of the situation, is slower than expected response times. So when we're in the height of receiving, managing, distributing, tracking, reporting on vaccines, that is a likely challenge, whatever solution it might be. A question that we as an industry, health systems and employers need to look at is what comes next. So it's not just response times, though that's a real factor. What do we now do? How do we encourage our community members, our family members? We're, as of May 2021, there is a surplus of available vaccines. So part of this is adoption and getting shots into arms. And then as we even look beyond that, as society now returns to something of a new hybrid normal, what is to come next? So will Enterprise Health have a solution when the next challenge comes, when the next COVID-19? How do we think about seasonal events and vaccinations differently, and employee and occupational health? So those are much bigger questions, but COVID sure put a bright light on an immediate need. And Enterprise Health, with their solution, has shown to be a good option to help in the time of need. And now we look towards getting employees back to work and safety and health well beyond just that.
Well, Joe, thank you for spearheading this report on Enterprise Health. I know vaccine distribution is an important topic to many people, so I appreciate you coming in and talking about it today too.
Thank you. Get vaccinated if you haven't.
Thanks, Joe. And thank you for watching today. If you're interested in learning more about Enterprise Health and their vaccine distribution solution and what their customer experience is, you can download that report on our website at classresearch.com. Also, if you know of anything that's innovative or disruptive in healthcare IT, we want to know about it. We'd love to do a spotlight on that solution too. Let us know at etech@classresearch.com. Thanks again for watching today. Have a good day.